Good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining me this afternoon for Facebook Live on January 27th, 2022. So today is going to be about Omicron pandemic-related things. And yeah, let me get right to it. And as always, as I'm going through the information that I have, if you have questions, please send them our way and I'll try my best to answer them. So I'm going to start with some visuals. Okay, so this was just to give you a sense of this week's numbers for the county that they posted last Friday. You see the cases were 1,600. And then Matt's going to show us the week before that. So I show that to say that, the cases the week before that were quite a bit more of them. And then the positivity rate was quite a bit higher. So I think we have a couple other things to show that we usually do too. Yeah, just a moving day average of this is cases, and then the next one is hospital admissions and percent of beds that are used in Whiteside County. I just wanted to show all those, not that the absolute numbers matter so much, because there's some ebb and flow in those. But the good news is the trend is moving in a positive direction. The number of cases, hospitalizations, those type of things from this Omicron surge are definitely improving here in our area. So I thought that was good to hear. Matter of fact, in the U.S. in the past 14 days, the number of cases in the U.S. are down 21%. Hospital beds in the state of Illinois, I think it was 3 weeks ago, maybe it was 2, got as high as about 7,400 hospital beds were being used in the state of Illinois for COVID patients. And now we're down to about 5,000. So a nice trend as far as that goes too. So I want to talk about Omicron for a couple minutes here. So just to give some numbers and add some color to this conversation, number of cases peaked January 15th at 806,000. The Delta peak was about September 4th, and it was 164,000. So 806, 164, definitely a difference in the number of cases. Hospitalizations for Omicron appear to have peaked January 20th at 159,000 folks that are in the hospital. Delta peak was about September 17th, 102,000, 159, 102,000 differences there. Number of people that have died from Omicron during this Omicron peak. It appears that the peak was January 25th at about 2,200. The Delta peak was late September and was about 2,100. So 2,200 to 2,100 deaths from Omicron versus Delta. And also to give you some perspective, before we had vaccines and that surge that happened in October through January-ish of 2020, early 2021. Peak was January 13th, and that was 3,400 deaths during that pre-vaccination surge. So comments on that from my standpoint would be that, first of all, the pre-vaccination surge numbers are probably reflective of the fact that there were not vaccinations as a big part of that. So people that got it didn't have we just had to try our best for them. But there are people that were higher risk that were getting it who weren't vaccinated. And then that ended up not so well for a lot of people. So the other points, though, is as you've read, I've been saying, others have said, this is not as severe in terms of the actual on average, how sick you get from Omicron versus Delta. 27 cases of 1,000 cases of people that get Omicron, about 27 of those people are hospitalized. Of 1,000 people that got Delta, about 78 got hospitalized. So 27 versus 78, pretty significant difference there. So it's less severe, but you got more people that have it. So the math on that it still ends up with similar or more hospitalizations and deaths just because of the numbers, the sheer number of people that are getting it. So I wanted to make sure that I made that as clear as possible. I wanted to talk briefly about a subvariant of Omicron that I'm reading about. It's the BA2 subvariant. And I think it's something we'll have to see about. In Denmark, it's 50% of the cases right now. And a little variant or a variant of this variant is that they call it the stealth Omicron, in that it doesn't, the PCR tests, which are the tests that are the most accurate that we use right now, it doesn't seem to pick up quite as well with that PCR test, which will, as it makes its way to us, if it makes its way to us here in the US and Whiteside County in particular, that'll pose some challenges in terms of trying to figure out what to do with folks who have symptoms. So I don't know what the future holds, but it's something we're going to be watching. Vaccine-wise, just read an article this week that if you get boosted, it looks really helpful in terms of immunity, at least for 4 months after that booster, somewhere in the range of 90% or so in terms of preventing hospitalization. Also read that folks who are vaccinated and then get a natural infection have really good immunity. If you don't want to get the natural infection, if you can avoid it, but if you do happen to have that, get that natural infection, and you have and you're fully vaccinated, the combination really does a number in terms of helping your immune system. Now, also in that, if you get natural immunity, your response in terms of if that's all you have and you don't have a vaccine, there's a lot of variability in terms of the immune response that your body mounts and that it maintains just if you have that. So it's not as good just to get a natural infection. So my point there would be, yeah, for those of you who have been vaccinated, good move, because the vaccine, of course, is helpful in terms of keeping you out of the hospital right here, right now. But if you're one of those folks who is vaccinated and happens to get COVID, that combination is very helpful in terms of your immune system. I want to talk a little bit about treatments for COVID and how they stand right now in our area, and for that matter, in our state. And that is, they are not real plentiful. So the monoclonal antibodies that right now that we're using that's been approved, that works, is called sotrovimab. We still have some here at the hospital. I anticipate in the next several days, probably we will run out of our sotrovimab supply, and then we'll see if we get more in from allocated. It goes from the federal government to the state, and the state allocates it based upon they have a formula that they use. So we'll see if how that works in terms of whether we'll get more of that or not. The oral, Molnupiravir, Paxlovid, Evusheld, sotrovimab. Okay, so let me just go one by one. The Molnupiravir, I'm butchering that. Anyhow, that's the Merck product. And no, that's going to go to retail pharmacies. It's not going to come to the hospital. That's an oral medication. And we do not have that. And my understanding is it's pretty slim pickings if at all, in local pharmacies. So the supply of that is not anywhere close to the demand of that medication. By the way, that Merck product is the one we've talked about. Its effectiveness is not great. It's somewhere in that 30% range, and it's not to be used for women who are pregnant or who might be considering getting pregnant because of some of the concerns with it. Paxlovid is the Pfizer product, which so far at least has looked to be very effective, but it also is in very short supply. I'm not aware with it being any local retail pharmacies like Walmart, Walgreens, etc. My understanding is that will not be sent to the hospitals, so I don't anticipate our hospital getting any of that medication. The Evusheld is a product That is I guess you'd say it's a preventative product for folks who are at the highest risk of, if they got COVID, they could have significant issues. So, in particular, folks who are on certain types of chemotherapy and have certain solid organ plants that they've had, those type of patients, that medicine is for. We do not have it, as far as I'm aware of, and I'm not aware of anyone in the area that has that right now. The sotrovimab is the one I was referring to that we do have here at the hospital in a limited supply. Um, as I was saying, I anticipate we'll probably run out of that supply in the next few days. REGEN-COV, the government is no longer recommending that we use because it's not effective for Omicron. Same for the, we call it the BAM-ETC. I'm not even going to try to pronounce it, but the two MABs together. Once again, the government is saying it's not working for Omicron, so we're not giving it out. And then the bamlanivimab by itself, once again, not working against Omicron, so we're not using that. Thank you for that question, though. How many uses can you get out of a KN95 mask? I don't know thanks, Jasmine. I don't know the exact number, but basically, if it's not really soiled and you're not getting it really soiled, I think you can use that for a good amount of time. If you're just going to the store with it and then you're not wearing it, you're not going to wear it around the house, obviously. But if you go to the store or going to the pharmacy or, I don't know, something in a public place, and you're wearing it for those purposes, I would be comfortable wearing something like that for a week or so, unless it got visibly soiled or got wet or something happened to it. Or if it's not fitting as well, and that's the other part of that, is it's variable for every person, but if it starts to get kind of loose on your face and you don't have a nice seal, then it would be time to move on to another one. Okay, speaking of masks, we've been getting some calls here at the hospital. You've read some stuff about the government sending out, I think they're going to send out 400 million N95 masks at some point in time. We do not have those here at the hospital. We've not been allocated those. My understanding is they will not be sent to hospitals, but they will be sent once again to retail pharmacies. I'm not sure, but maybe health departments as well. But I know for sure retail pharmacies, they have not been shipped yet. And my understanding is that's going to be somewhere in early to mid-February that those will be shipped out. What else do I have? Blood shortage. So if you read across the country, there definitely are issues with blood shortages. One of the questions that's come up in previous these broadcasts that I didn't have an answer for was, can you still give blood if you've had COVID or if you've had a vaccine? And the answer is yes. You sure can. If you actively have COVID, if you're within that 14-day window of starting to have symptoms, that's not a good time. But after that, yes, please give blood. And if you've been vaccinated at any point in time, before or after you've been vaccinated, you can give blood. Reality is you don't get COVID from getting you can't give COVID to someone from a blood transfusion. So I did want to show something that for our viewers, something that's happening locally. So it's a blood drive happening February 3rd. The location is the Bethel Reformed Church. That did change from here at CGH to Bethel. So thanks to Bethel for being willing to host that. And there's the phone number to call if you're interested and willing to donate. I'll let that sit up for a second there. So yeah, we very much appreciate CGH's hosting this blood drive. And if you're so inclined, or you know someone else who would be, please give, because that will help with the shortages. Okay, so please feel free to send me any other COVID questions you have. I did want to transition to one other piece of information. I think that's on my COVID side of things. Yep. I read just today that the CDC is saying that 11.3% of us in the US have diabetes and 38% of us have prediabetes. That's 50%, or close to it. So I just bring it up because it's one of the themes that we've been talking about during this broadcast is that we don't know how long we'll have to do some sort of different way of going about life as a result of this pandemic. It's looking promising as far as this variant goes, but what the future holds beyond that, we don't know. What I do know is that other life issues keep happening. So whether that be that you have diabetes, or you need to check to see if you have diabetes, or your weight has crept up in the past year or two and you need to do something about that, or you have high blood pressure that you need to see the doctor for, or you're due for your mammogram, or you're due for your colonoscopy, please just please go forward. And I encourage you to take care of those kind of things for yourself, pandemic or no pandemic, because the longer this goes on, and like I said, I don't know how long this is going to go on, other health things build up. And this diabetes, prediabetes, to me is one of those things, in particular the prediabetes. 38% of people have prediabetes, many of whom don't know it. That's something you can take action on, and you can lose weight, and along with that, ideally exercise and or both. And you can go back to normal blood sugars in some cases, which reduces your risks of having future health problems. Enough said. Okay. I wanted to say that next week, Dr. Coons, who it seems like he's becoming my permanent guest host. I'm not going to be able to do the broadcast next week, but you're going to be in good hands with Dr. Coons. So Dr. Coons is going to take the rudder here for next week's broadcast. I want to give one more moment if there are any other questions that have come up. If not, thank you for taking the time to tune in, and I sure hope you have a great week. From CGH, this is Dr. Bill Bird. Good day.